Welcome to the Best of Beaver County, presented by St. Barnabas, a weekly segment dedicated to putting the focus on the amazing things and the amazing people behind them in Beaver County. The Best of Beaver County is sponsored by and content is provided by St. Barnabas. The show airs every Thursday from 11 to 11:30 on WBBP, WMBA, 99.3 FM, and Facebook Live. Now, with no further ado, let's welcome host Mike Romai to introduce today's program.
Good morning and welcome to the Best of Beaver County show on the St. Barnabas radio station. I'm Mike Romai, and because our topic today and the initiative at St. Barnabas has started, it's so very important that we have invited Jeff Bost back. Jeff Bost, I'm sorry, Jeff, back to the show. Jeff is a neurosurgical physician assistant who, along with Dr. Maroon, has co-authored a book entitled Fish Oil, the Natural Anti-Inflammatory. Jeff is here to talk about a topic that most people will never want to talk about, but may have to, and that is how and when do family members discuss memory loss and dementia for parents and loved ones. Jeff, welcome back to the show.
Thanks, Mike. Glad to be here again.
Before we get into the topic, tell us a little bit about fish oil and what it is and what are the benefits.
Well, I've spoken in the past. I've written, along with my colleague, Dr. Joseph Maroon, 3 books on fish oil. And it's not that we're suspicious of fish oil. Matter of fact, the absolute opposite. We're very much using fish oil. We recommend it to our patients. We have so for about the last 20 years. And it really started back 20 years ago thinking about anti-inflammatories and the use of anti-inflammatories. Still today, you have an ache, you have a headache, you just pop a pill. And the problem is they have significant side effects. And patients, when they see us with spine problems, take handfuls of it and are suffering the side effects, including ulcers and stomach irritation, and even in some cases, kidney failure. So we were thinking of an alternative and came across fish oil. And fish oil, it's really not the fact that it's from fish. The fact is that there's 2 molecules in it that are very beneficial for every cell in the body. And I think that's the key to a lot of supplements is how they work. You have to understand it. And they work on every cell membrane in our body. And when inflammation strikes, those molecules can come to the aid of our body and reduce inflammation. So we have used it, and we recommend it be used as an anti-inflammatory.
Jeff, is there anything that would reduce its effectiveness?
Well, not everybody can take fish oil. Some people just can't take the oil. Some people are on certain medications, for example, certain blood thinners. You should certainly ask your doctor before taking it because of some interaction with the platelet function. But overall, we get fish oil and the molecules in it in our diet when we eat fish. The problem is that the way most people get their fish is from fried fish. And when you heat fish oil or fish with high heat, like boiling oil, it ruins the molecules that are beneficial for our health. So taking it as a supplement really is one of the best ways to get the amounts that you need as well as the purity and quality that you need. So it's generally not harmful. As I said, most people don't have trouble taking it, but some people do complain of some gastric upset.
Is there a particular age when one should begin using fish oil?
Well, I think I mentioned it before. It's recommended once a woman becomes pregnant to start taking it. And the reason for that is that the growing child needs the omega-3 to build their brains. 40% of the brain cells are made of omega-3 as a structural component of the cell's wall themselves. So you need this to build brain cells, and if the child is deficient in it, there's studies that show it may affect brain function and other nervous function in the long term. And the way the child gets it is obviously through the mother. So the vast majority of Americans, based on our diet, are deficient in omega-3, about 95%, which is a huge number. And so a woman who isn't getting enough for themselves and then has a child is really going to become deficient. And as a matter of fact, there's a link to deficiency in omega-3s and postpartum depression that can occur in women. So it's really critical at all ages, starting even before birth, throughout our adult life for sure. as we grow older, it's very important, as I mentioned, for joints and other functions of our body as an anti-inflammatory.
Is there a difference in whether you take it in the pill form or as a liquid?
Well, a lot of people just don't like to take it in a liquid because of not only the taste in some cases, but just the oily texture. Capsules a day are generally digested in the gut rather than the stomach, where they are less likely to cause stomach irritation. Those are called enteric capsules. They digest lower in the colon so that you don't get that burping or regurg that some people complain about. But both have the active ingredients, which are EPA and DHA, and these are the molecules that are found not only in fish oil or other seafood, but it's also found in plant-based materials like flaxseed is another source of that. So it's something that's beneficial no matter how you get it. But as I said, the vast majority of Americans are deficient in it, and so really it's recommended pretty much for everyone.
In terms of taking other prescriptions or medications, is there any interaction with fish oil?
Well, as I mentioned, certain blood thinners, it can be a precaution. I think that's really the main red flag associated with it, and it's only something that can occur in certain medications, so it's something you'd want to talk to your doctor about. Any supplement, whether it's even a simple vitamin, you want to discuss with your doctor before you take it if you are on medication. Even vitamins can have interaction with certain blood thinners as well. So it's really goes back to if you're not taking any medicine, certainly you don't need to inquire or you don't have to per se, but if you're taking any kind of medications and a dietary supplement, you should be talking to your doctor about it.
Okay. We're talking with Jeff Boast from the St. Barnabas Health Systems, and we're talking about dementia, and Fish Oil is a book that Jeff co-wrote with Dr. Maroon. I know from past conversations, Jeff, that you've talked about the dementia, and the dementia is not a normal part of aging. It doesn't have to be. What are some of the recognizable or not recognizable signs of dementia?
Right. Well, I think that's really the topic of the day, Mike, is to try to let our listeners know that exact question. When is it just simply forgetting your keys and not really worrying about it? It happens to all of us. And when is it the tipping point or the red flags that tell us there's something more going on? And really, the insight to know that becomes more difficult as you develop dementia. So it really becomes a factor of the family or friends that have an idea or a concept of when the red flags are and what's happening. And I'm going to go over a list of them, but certainly they're not inclusive as far as the things that can happen. And it's often, a critical instance that it occurs where people begin to wonder, is something wrong with the thinking of my mother or my grandmother or my grandfather? It can be a crisis like a fall. It can be a crisis like something was burning on the stove. Those things are often bring it to attention, but just the idea of acting early rather than waiting for those crises. So some of the things that people will notice perhaps is challenges with planning or problem solving. That goes to the cognitive portion of our brain, not necessarily the memory. So when you have dementia, it affects all spheres of the brain's thinking capacity, whether it's cognitive or emotional. They can have mood swings or personality changes. They get confused as far as what time or day it is. And I know myself now, in COVID time, it seems like Groundhog Day every day as far as forgetting dates. But the fact is, if that's a chronic problem, what month is it? That sort of thing. And we certainly ask a lot of those questions in the hospital, for example, who's the president? What's today's date? Those sort of questions that really show a gross amount of cognitive problems. Mm-hmm. Memory loss is certainly part of it. Misplaced objects, problems with communication, really can't express what they want, and we all get a little tongue-tied, which happens certainly on the radio as well, but when it becomes more of a problem about communication. Poor judgment. The scammers unfortunately love people with dementia because they find that they're easy marks. And so, money missing from accounts, money issues, financial problems, not paying bills, those are all red flags that we need to worry about. And then falling itself, misplacing, where's your foot in space, and falling and tripping is certainly a red flag as far as something's going on as far as dementia. And then withdrawing from social activities, really becoming more and more isolated, and that certainly is part of the depressive feelings that one feels when they're just not thinking right. They can't engage in conversations. They really can't participate anymore in the social interactions and conversations, and so they withdraw. They're embarrassed. They become less active socially. So the family, it really is incumbent upon the family to look in the window, if you will, and see what's happening, because the insight in someone who has dementia really is one of the first things that go away. Denial and lack of really self-assessing your problem.
There's just so many things to consider, and in our lives today, we get so busy that we may not always have time to check up on those loved ones. And even as far as going on Zoom, which a lot of adult children try and get their parents involved with, sometimes just the technical aspect of the digital age confuses them even more.
It's almost impossible when you even have mild dementia to manage through the electronic maze that Zoom and computers are. And so it becomes a cycle where less and less interaction, more and more withdrawal, especially in COVID, which has markedly accelerated these problems. So the question is, how can a family member move forward to make these assessments? And those are some things I'd like to talk about as well.
Yeah, that would be very interesting to hear about, because some adult children may not want to recognize or admit that they see some of these things that you've been talking about, because that would mean they have to do something with mom or dad.
Well, I think that when something needs to be done, it has to be done. You know, we tend to procrastinate. We tend to delay action because we're giving the benefit of the doubt. And that's, we say that in the business, it's sort of what we call the enablers, the people that make excuses for it. And it's out of love. It's not like they don't want to necessarily do the job that has to be done, but they don't want to offend. What is the timing? When should we do it? And the key to all of this is the sooner the better, because when you go to that crisis point, which I talked about earlier, when it becomes a crisis, then you're not prepared. And if you're not prepared, then that's when things really become messy. Do you need emergency services? Do you have to find temporary place for someone to stay? It really can be a crisis.
Jeff, could you walk us through some of the things that family members should do in terms of the next step? What should happen next?
Right. Well, the first thing is recognition. We talked about some of the red flags. So if everybody sort of comes to the agreement that there's a problem and we need to solve it, you have to develop a plan. And I'm not talking about an intricate plan, a plan that would require many steps. But the first thing to do is determine who's going to make the talk. Who's going to be sort of the captain of the ship, because it really is a focused conversation. If there's a lot of people there, which can work as well, there can be defensiveness and sort of feel like you're being beat up upon. So it's the idea of picking one person who really can go through the issues that the family sees and what can be done. One of the first steps often is to tell the family member, we'd like you to come and see the doctor. Come and the PCP or someone they've had trust with over the years is usually the first step in how this goes, because they want a professional, the family does as well, to make sort of an assessment. And so the professional can be that gateway into the care that person needs. Obviously, the doctor has more training and can look at signs and symptoms more clearly. But before you get to the doctor, oftentimes you have to do some convincing. Some of the things that you want to ask is, what did you do today? What were some of the things? What is today's date? What was our conversation last week? Did you shower today? Have you brushed your teeth? Just even simple hygiene questions. Are they being done? Disheveled look, clothes that were typically kept pristine are now stained and wrinkly. These things, whatever's out of character, so to speak. As I said, some of the financial matters would be something. How's your checkbook? those are some of the things that the family can start with to get the conversation going.
Okay.
But it really requires, doing something. Anything is better than nothing in this case.
Very good. Jeff Boast is our guest. We're talking about dementia and memory loss, and we have to take a break right now, Jeff. But when we come back from the break, I'd like you to talk about the program that St. Barnabas has initiated, which is really exciting for families and family members who may be dealing with memory loss. And we'll continue our conversation with Jeff Boast from St. Barnabas on the St. Barnabas radio station. I'm Mike Romai.
About your mom or dad, have you noticed a change in behavior? Forgetful and not as sharp? So where can you find help? St. Barnabas Memory Care is a wonderful option. Yes, St. Barnabas has helped thousands. Take advantage of their free in-home assessment of your loved one. A St. Barnabas professional will provide a no-charge evaluation of your personal situation. St. Barnabas can help you. Call 724-625-4000 or go to stbarnabashealthsystem.com/memory care. St. Barnabas is apart from ordinary.
This is the Best of Beaver County, brought to you by the St. Barnabas radio station. I'm Mike Romai, and our guest is Jeff Boast. And we're talking once again about memory care and dementia. And St. Barnabas, as we said before the break, has an exciting program that families can get involved with in terms of getting some kind of gauge on whether or not you or a family member may have problems with memory loss. Jeff, can you tell us about that?
Absolutely, Mike. St. Barnabas has offered and is offering a free memory care evaluation, initially with a phone call and then followed by a free in-home evaluation for exactly the reasons we've talked about. Home people are not professionals, whereas those at St. Barnabas are, and they can ask the right questions and go through some of the symptoms and red flags that a family member may hear about. It's simply a phone call, 724-443-0700, or going to their website, stbarnabasmemorycare.com, and getting linked with the professionals who can ask the right questions. And that first step, as I discussed, is the hard one, but you really have to do it if you have a suspicion. Earlier intervention is better than later.
Is it possible to do this by phone?
Absolutely. It's not ideal in a non-COVID world. It probably the next step would be to have the person come and be evaluated. But now with the COVID and making it more convenient, St. Barnabas is offering in-home evaluations. But a phone call can certainly be one of the first steps, even just for the families to learn more. What are some of everybody's an individual as far as what happened or what's going on, and the person on the other line at St. Barnabas really can determine whether this is something to be concerned about.
Okay. Jeff, can you define cognitive decline? Is it something that only happens at a particular age?
Well, cognitive decline can happen from toxicity. If someone drinks too much alcohol, they're going to suffer from cognitive decline. So cognitive decline is more or less a symptom, not necessarily a disease in itself. But there are so many causes of cognitive decline, whether you've had a stroke or things like brain deterioration. But as far as when it can happen, typically we would our brains are preserved for many, many years, and in our 70s and 80s, many people do have some cognitive decline. The question is whether it's a pathologic change, like a disease or a condition like Alzheimer's. And so we will suffer from mild cognitive decline, many of us, but it doesn't necessarily mean it's in a disease condition. And as we talked last week, there are reversible conditions that can affect cognitive function. We talked about certain medications and drugs, tumors and hydrocephalus and thyroid problems. These are all things that can be reversible. And another reason that people, when they're trying to determine whether their family or loved one has a problem, a doctor can rule out those problems. It's this drug. You remove the drug, and all of a sudden your grandma's back in shape. The brain function is returned. So it's very important to look at all the factors that can be causing cognitive decline rather than just say, oh, this has to be Alzheimer's because her grandmother or mother had it.
That's very interesting. You're saying that sometimes it can be reversed?
Absolutely. If the cause is not a progressive condition like Alzheimer's or Lewy body disease or other more common problems associated with chronic dementia, absolutely. A condition that we in neurosurgery take care of routinely is a condition called hydrocephalus, where the drainage of the spinal fluid from the brain is diminished and it builds up in the skull and causes pressure on the brain, which can affect cognitive function, balance, all kinds of problems that are associated with that if you put a shunt in or do other maneuvers surgically, often that can be relieved. So things are reversible. Cognitive decline related to a disease like Alzheimer's disease is not, but the question is, can we do things to intervene or try to slow the progression? And that's for another talk later on.
Yeah. Jeff, can these signs be concealed in terms of what somebody who may sense it in themselves, they'll do to try and cover it up?
Well, we're humans, and we're humans in the sense that we love our independence. And people will hide issues, put them under the carpet, so to speak, and make it such that there's nothing wrong. And there's that adaptation that humans can do to adapt to, if we keep on forgetting our car keys, well, sooner or later we'll put a hook on the wall and we'll know that's where our car keys are. So there are adaptations that can be done. Not everybody has the same degree of cognitive decline and dementia, and certain adaptations and things can be certainly done to allow someone to live many, many years independently with just mild assistance, whether it's someone that comes in to make their meals for them because they left the pot on the stove one too many times. There are things that, we can adapt and change, but people will tend to hide it. The thing that you worry about, Mike, is when it becomes a crisis. There's a fire in the house, there's a fall, there's something that, really is the red flag. Hospitalizations are one of the most common reason for someone to have dementia worsening. So they go into the hospital, they can develop a condition which is called hospital psychoses. Usually it's reversible, but in some people it's not, and it's often a red flag that there's underlying dementia or maybe progressing to dementia. So having someone coming home from a hospital and all of a sudden can't manage their checkbook, can't make their meals, is a red flag that something needs to be done.
Well, I can't imagine how frightening it must be for somebody to face losing their independence, whether it's what you just talked about, somebody coming in to make meals or doing their checkbook, or the worst of all, I think, from what I've heard over the years, is that you take away their keys and take away their driving privileges.
Right, and that's there's no doubt that that's not traumatic, and so none of us believe we want that to happen. However, we survive after it does, we think of care that we receive when these things occur as a negative, and I think that's one of the things that St. Barnabas tries to get the word out, that this is not a negative. Living in a place where there are other people that you can socialize and be with and have good cooked meals and have safe areas to walk is actually a step up. So it's really what is appropriate for certain parts and times in our lives. And the frightening, when people are frightened and want to maintain their independence, it's because of not really knowing what's out there and what's available.
Jeff, it seems like that has to be a full court press, especially by the family. Everybody has to be on board. And by going through a program or beginning the talks through a program like the one at St. Barnabas, to have a medical professional there helps ease the way.
Absolutely. It helps the family to feel better. And plus, there is no doubt there'll be a number of people who will call or contact St. Barnabas, and they'll say, no, this is a drug, or this is not an issue at this point. So it really is a discernment that you often need a professional to help you with, and that's the key to the program that they're offering.
Mm-hmm. And while they're at home, and maybe family members are starting to detect something wrong, are there things that you could do in the house to make it less dangerous for them? The way they dress, some of the things, the way they have the rooms decorated or furnished?
Yeah, it's a great question. I mean, living at home as long as possible and it's safe is a good idea because a familiar environment and routines are some of the things that can maintain cognitive function and also reduce anxiety. Anxiety, the emotional component, can certainly worsen things like dementia. So as you just described, having the meals cooked, taking that burden off the person, routine clothes, Mondays you're going to wear this, Tuesday, and having those set out and ready to go. Laundry, those things can be managed as well. So there are patterns and routines, but, are you getting your medications? That's really one of the big things that bring this to a head is missing pills and medications. Someone who's a diabetic can't take their insulin anymore because they can't remember to take it. And so those patterns of life with assistance can allow someone to live in their house for a longer period of time.
Jeff, are these all things that are discussed during the initiative, maybe not through the first phone call, but as you go on with the evaluation? Are these things that will be discussed with the St. Barnabas professionals?
Absolutely. This and more. It's really a education that the family and the person would receive. It's a process. There's testing. There's evaluations that go forward, and it's really A to Z type coverage as far as where you are. Just like if you had a broken arm or a broken leg, what needs to be done? We need to set the bone. We need to make sure your blood vessels are still going into your hand. Making sure that we check up on. It's a whole series of steps that medical professionals look through and do as a checkoff list to make sure that they're doing the right thing.
Yeah, and initially, when maybe the family members and the individual have this conversation, are there things that you can explain to the person having these difficulties that you're not just trying to put them in a home?
Well, absolutely. And what happens is, it isn't like one day someone from St. Barnabas will get a call, and then the professional from memory care will get a call, and then the next day the person is in the memory care unit. It's usually, on average, quite frankly, a 6-month process, and it's not because of necessarily availability at St. Barnabas. Is the fact that it's a process of digestion. It's a process of learning. It's a process of going through what is being provided for you, taking steps to see what the person can stay at home. What interventions can be done. So it's not something that it's not someone coming into a facility kicking and screaming. Mm-hmm. It's someone that's learned about what's happening. What are the benefits? What are the things that are going to be provided for me? The education part of it.
Mm-hmm. And is this the consultation? Is it a free consultation?
Absolutely free, Mike. And it's really special that they're doing this and offering it at this time, especially as people are having more and more difficulty interacting with their loved ones. To simply make a phone call to get a professional on the line is really quite a service. Okay.
Can you repeat that phone number again for people to call?
Absolutely. 724-443-0700, or go to stbarnabasmemorycare.com.
And there's information on this program on the website?
Absolutely. There's soon to be actually recordings there of what we talked about. If you missed some of the sessions, they'll be there as well. So we're trying to build a library of information as a resource, but the phone call is the first place to start, and the website also can help support with other resources.
Well, Jeff, this is very important and life-changing information that you've been passing on, and we appreciate you coming on the program to talk about it. Jeff,
thank you, Mike.
Thank you very much. Jeff Boast from the St. Barnabas Healthcare System. I'm Mike Romai. This is the best of Beaver County on the St. Barnabas radio station. Thank you, stay safe, and we'll talk again.
About your mom or dad, have you noticed a change in behavior? Forgetful and not as sharp? So where can you find help? St. Barnabas Memory Care is a wonderful option. Yes, St. Barnabas has helped thousands. Take advantage of their free in-home assessment of your loved one. A St. Barnabas professional will provide a no-charge evaluation of your personal situation. St. Barnabas can help you. Call 724-625-4000 or go to stbarnabashealthsystem.com/memorycare. St. Barnabas is apart from ordinary.
Thank you for listening to the Best of Beaver County. St. Barnabas is pleased to have provided content and sponsorship for the program. Tune in this Sunday at 11:30 for an encore presentation of today's program on Beaver County Radio. and next Thursday at 11 for another edition of the Best of Beaver County on WBVP, WMBA, and 99.3 FM.